Hello, and thank you for your interest in joining our efforts to understand and define the safety and efficacy of early initiation of venous thromboembolism prophylaxis in patients with isolated traumatic brain injury. This project will be examining differences in early and late initiation of VTE prophylaxis with the hope of demonstrating that early VTE prophylaxis is associated with lower rates of VTE without an increased risk of intracranial hemorrhage expansion. We'll also be comparing these outcomes between different chemoprophylaxis agents, as well as outcomes of patients requiring IVC filter placement as an alternate strategy for VTE prophylaxis. There is a lack of evidence-based guidelines regarding the timing of VTE prophylaxis initiation. The most conservative recommendations support the initiation of pharmacologic prophylaxis within 72 hours of injury. The current ACS TQIP guidelines for VTE prophylaxis management after isolated TBI includes initiation of pharmacologic prophylaxis within 24 hours for low-risk TBI and within 72 hours for moderate-risk TBI. High-risk TBI should be managed with IVC filters or by other strategies. This study was designed as a multi-center retrospective cohort study with comparison groups that will define early and late initiation of VTE prophylaxis by a 24-hour cutoff from stable CT head. After identification of isolated TBI cases, data will be recorded using a simple data collection tool and a REDCap database to coordinate collection between sites. It is our hope that the results of this study will provide the data necessary to convince surgeons that early VTE prophylaxis initiation is safe and effective. Lower rates of VTE events and intracranial hemorrhage expansion has 3 benefits in minimizing patient morbidity, lowering costs to patients, and minimizing spending of healthcare dollars. We hope you will consider joining our efforts. Thank you.